Hey, what's going on? It's Ian Hart with backpainreliefforlife.com, and I'm pre- and postnatal certified and co-creator of Back Pain Relief for Life. So, today I'm going to speak to you about pregnancy and back pain relief. You're probably here because you're pregnant and experience back pain. And what I want to speak to you about is the changing anatomy when it comes to pregnancy. First off, there's a hormone called relaxin that's created by the body. And relaxin is there to create joint laxity. So this allows for your pelvis to widen, for your ligaments to actually be stretched. With that being said, we do not want to stretch ligaments too far because ligaments do not go back to their normal position if it's stretched a certain percentage beyond what it's supposed to be stretched. Which is why you'll see like dancers who are young and they stretch their ligaments too long have injuries and stuff like that. So, when you're pregnant, don't overstretch or overdo any stretching too much because you can create that issue because of this hormone while you're pregnant. So, that can create back pain on its own if you have too much laxity in the joints and in the lower back. Also, your pelvis begins to widen, and the reason is so you can give birth. So when your pelvis widens, it also puts stress on other joints, other muscles, and all the muscles cross the pelvis and the lower back, and so the main point, it ends up in the lower back. And I'm going to explain to you later why certain exercises are very important while your anatomy is changing. And then also you have an anterior pelvic tilt, which is a major culprit. And I'm just going to show you really quick, as if I was pregnant, what happens to the body. So I'm going to use this. This is going to be my baby. So I'm going to put this under here, and when your stomach begins to get a little bit bigger, what happens is your pelvis starts to tilt. So as the stomach widens, the pelvis tilts forward, which we call an anterior pelvic tilt. And I'm going to explain this a little bit more in another video. But when your pelvis begins to tilt, there are certain muscles that become overactive and other muscles that become weak. But right away, you can see my lower lumbar spine was in a neutral position, and then all of a sudden, I get an anterior pelvic tilt, and all of a sudden there's compression on the lower back discs and muscles, and that puts a lot of strain. Also, the hamstrings become underactive, and the abs become underactive. So what we want to do is allow for our pelvis to be in neutral, at least do exercises that bring the pelvis into neutral during the exercises, so it creates relaxation on the lower back. It activates the abs a little bit more, and these are very important muscles for when you have pregnancy and then afterwards, so you can recover faster from the pregnancy. So there's a few exercises that you can do that'll help. I'll take this out, and those exercises we're going to post right after this video. And there's two exercises specifically that are going to help you get into that anterior pelvic tilt and then activate other muscles. And so we want to stretch the tight muscles and strengthen the weak muscles, so we prevent the muscular imbalancing from exacerbating, leading to more back pain. All right, so we're going to show those exercises right after this. I want you to do 3 sets of 8 reps of both of these exercises, and you will see right away that it'll allow you to have relief. And this is specifically for somebody in the first 2 trimesters, because the 3rd trimester you don't want to be laying on your back completely. All right, so go ahead and do those exercises. If you're interested in a full program that's beautiful for pregnant women who experience back pain, go ahead and click the link below at backpainreliefforlife.com. It's a program that has 8 movements. It's not only perfect for back pain, but it's going to help your hips, your pelvis, and your whole body actually loosen up, feel better, feel more relaxed. So that's Back Pain Relief for Life. Go ahead and click the link below and check and see if it's good for you. Again, this is Ian Hart, pre-postnatal certified and co-creator of backpainreliefforlife.com.